I'm Catherine McGrady, the CEO of CNA, and this is CNA Talks.
Saying Americans will need to learn to live with the virus, this morning authorities believe our nation is transitioning from pandemic to endemic.
We've reached a new moment in the fight against COVID-19, where severe cases are down to a level not seen since July of last year.
We're just not done with it, and it's a mysterious virus in many ways, Erlina, so we don't really know what's coming down the pike here.
Hello, and welcome to episode 107 of CNA Talks. My name is Eric Trabert. I'm the director of the Center for Public Health Preparedness and Resilience within CNA's Institute for Public Research. Joining me on the podcast today is my colleague, Young Lee, who is a senior research scientist at CNA. Young, it's great to have you with us today. Can you provide the listeners maybe a little brief background about yourself and the work you do at CNA?
Great. Thanks so much, Eric. And it's very good to be with you all here today. As Eric mentioned, my name is Yang Lee. I am a senior research scientist here at CNA Institute for Public Research. My background is in epidemiology, and in addition to working in public health preparedness and response, focusing on biological infectious disease type of threats, I also represent our organization on the Global Health Security Agenda Consortium. The shorthand is GHSAC, as a steering committee member, and I'm also the consortium's liaison to the Alliance for Health Security Cooperation. And again, it's great to be here with you all today.
I wish we had had you on the podcast sooner. We've done, over the past 2 years, several podcasts focusing on the pandemic. And today I wanted to talk about something that's getting a lot of attention, which is this idea that we're entering into a new period in the pandemic. But what I'm really talking about is a shift in how we as a society think about living with the SARS-CoV-2 virus that causes COVID-19 moving forward. And it's really this kind of acknowledgement that the virus is here to stay and that we're at a point where we need to learn to live with it and manage it as we've learned to live with and manage other types of respiratory viruses that are still very much real threats to public health. But we found ways to monitor those viruses, to act upon them when we see surges, and to treat them effectively. And so for today's podcast, I'd like to kind of hit on 3 general topics. The first is, how should the public think about this transition into endemic COVID? Second is, what's going to be most important to public health agencies as they make this transition in their strategy? And then third, if we have time, I'd like to just kind of think a little bit about what might be some potential areas of study that'll be most important during this time as we move forward in our dealings with COVID. So Young, let's start at that first topic. I'd really like to get your perspective on someone with the public health background about how the general public might think about living with SARS-CoV-2 virus and the risk of COVID-19 moving forward from this point.
Yeah, absolutely. And I think we certainly have been hearing the term endemic quite a bit lately. The context here, I think, is important. We are in the 3rd year of this pandemic, and, there's certainly scientific distinctions among pandemic, epidemic, endemic. And having said that, I think in the practical sense, and particularly in the way that, we've been hearing about it, whether it's on news media or social media, I think it's mainly how do we as a global community live with it, like you said, since it does look like the virus is here to stay. And in terms of the impact to our public health and healthcare infrastructure, the number of positive cases and the severity of disease are both important in terms of, how do we look at the pandemic versus epidemic versus the endemic. At the same time, I think stepping in the shoes of the general population, most people don't deal with this on a daily basis like you and I do, and some of our public health practitioner colleagues do. So I think, when I hear the term endemic, especially looking at through the lens of the general public, the phrase I think we've heard in some instances is COVID-19 fatigue. I think that's a realistic thing. And in that context, it is here to stay. So in many parts of the world, we are still going through high positivity with emergence of new variants or subvariants is still a realistic threat. So I think the bigger picture here, I think, is how we should think about how to remain vigilant and not complacent. And at the same time, hopefully, between sort of collaboration and understanding mutually between how governments and the public health community acts and how the general population receives it. At the same time, not necessarily, inducing panic behavior like earlier in the pandemic when there was, panic buying, that sort of thing. And as we continue to navigate through the pandemic.
I think a lot of people understand that this endemic period doesn't mean COVID going away, right? It doesn't mean no COVID. But I think what's probably a little bit less clear to the general public is that it also does not mean no severe COVID. There's still very much a risk that there will be continued surges in the disease, which may be caused by, the rise of a new variant or waning immunity, because we're still trying to get a good handle on how long our immune response is, whether it's immunity built up through the vaccine and the booster, or if it's immunity acquired through natural infection. We still don't have a really good handle on how the strength of that immunity, how long it is going to persist. So there's still very much this threat of we're going to cycle through these instances where we may see upticks in cases, and there's still going to be people who get the disease and who end up getting a severe form of the disease and may require hospitalization and die. And so I think while we transition to endemic, that risk is still very much there, and it's important to remain vigilant and not get too complacent in how we act and behave. And what it kind of raises to me, Young, and I'd love to get your thoughts on this, is we got to think about it from this new risk-based framework, right? I think one of the constant tensions in the response to COVID has been around how, individuals perceive risk at an individual level, and then how we perceive risk at a higher level than just ourselves, right? Like, how do we perceive risk to our family, friends, coworkers, even strangers? And early on, when we didn't know very much about the virus, it was understandable to perceive risk as high, both to ourselves individually and as well as to those around us. But over time, as we've learned more about the virus and who's most susceptible to serious illness and death, I think, we've seen that shift a little bit, not universally by any stretch, but at least in some portion of the population, there's been this, I think, tendency, and we saw it particularly during the most recent Omicron surge, where reports were coming out that this was a less severe form than Delta. And maybe at an individual level, depending on the individual, but at an individual level, that might be true because it spread so much more rapidly and widely. When you looked at risk at a population level, right, we still saw significant surges in cases, more than we did with Delta. We still saw significant levels of hospitalization. And so I think when we kind of move into this endemic phase, trying to understand what is this new risk-based approach that we need to think about, how do you think about that as a public health practitioner?
I think the context here is important, right? So I think from a global perspective, some parts of the world, like you said, are in a better place than others. I think similarly, that's also the case in the US, right? Be a sort of a gradual transition or almost like a gradient, if you look at it as we go from dealing with a pandemic and epidemic to, hopefully one day soon to isolated cases in parts of the country or the world. Having said that, I actually hesitate to say whether we're sort of jumping the gun a little bit in terms of saying if we're in an endemic or not, or whether we're still navigating through this pandemic. But, I think how we continue to respond to your point in terms of this risk-based approach, it is depending on scientific evidence and data. And, in the last weeks, we have been seeing places in the US and around the world where rules are easing. And in many places, the data actually does support that. At the same time, with the ease of travel and folks begin to vacation, the warmer months are coming up in many parts of the world, we'll likely see upticks of cases because of ease of travel and sort of other factors that contribute to spread of disease. And I think there are also places in the world where zero tolerance rules still exist, right? And purely looking at it in terms of preventing outbreaks, that does work, but it's also such a complicated issue because other societal functions have to continue, and we just cannot be in an indefinite sort of state of suspense or lockdown, if you will. From my perspective, it is to your point about understanding the risks and what individual tolerance for acceptable levels of risks are. And at the same time, importantly, I think, one thing as public health practitioners that we should be able to do, or at least hope to do better, is to sort of convey the risk and, sort of help folks understand the risks that any one person may present to others. So as rules ease and, we attempt to gain some level of normalcy, I think individual actions in terms of how they act will impact what the future looks like. So for example, other folks right now, as rules ease, they don't necessarily have to wear a mask anymore. But for other folks like myself, we continue to wear a mask in public for a while longer to not only protect myself and others. So I think that risk question is sort of depending on an individual person in terms of understanding the risk, individual tolerance of the acceptable levels of risks, and just overall having that understanding of how we move forward with that understanding.
Yeah, that's something I've been thinking about lately, and I've actually talked about with my family and friends of mine, which is, don't be surprised as cases fall in certain parts of the country, and as restrictions get lifted, don't be surprised if we might have to reinstate some of those measures that we've had to live under previously, if there is an uptick in cases, to tamp that down. So it's not like this transition is going to be no more masks or no more social distancing or nothing, of the sort. I think it really is going to depend on closely monitoring how the virus evolves and where there are future outbreaks of cases, because we still have quite a large percent of the population in this country that hasn't been fully vaccinated or boosted, not to mention globally, right? You brought up earlier the fact that this is very much a global issue. I mean, oftentimes we're thinking either in our own communities or even just nationally, but there are parts of the world where very little of the population has been able to access vaccine yet. And so there are still large populations for the virus to move between. And we just got to be very vigilant, as you said earlier, in terms of our surveillance about when there are outbreaks, that gives more rise to potential mutated forms of the virus. And we just got to be very cognizant of that. And when they do kind of hit home with us in our communities, don't be surprised if we're going to need to wear masks again in public. I, like you, continue to do so, but I know a lot of people have stopped that. But we may have to put that on as a society again to tamp down sudden increases. So I think when I view it as this risk-based approach, that's kind of how I'm thinking of it. There may be kind of this cart menu of interventions you can do when there's an increase in cases, and we got to be willing as a group to do those, even if it allows us, some momentary discomfort. At least it will help us get through that, and then to a point again when we can hopefully lift those restrictions.
I agree with you, absolutely. And I think part of that is, sort of intrinsic to public health practice and scientific discovery, right? So, as we gain information, as we examine new evidence and figure out exactly what is going on, we are able to sort of adapt to it and change guidance, change recommendations as we move along, rather than just say, okay, we're no longer going to do this and that's it. I don't think that will be the case, especially if we're still sort of navigating high case counts in many parts of the world.
Yeah. Let's shift for a second to the next topic, which was, I know public health departments across the country right now are rethinking their strategies and how they're going to manage COVID and in this new environment. And we're seeing more states starting to relax restrictions. As these strategies start to be developed and finalized, how do you think those kind of pillars of our response to date, I'm thinking of things like testing and quarantine and vaccine and boosters. How do you think those pillars are going to come into play in these new strategies?
Yeah, so from my perspective, I think, globally, that's a difficult question. And I think that is only part of the equation. Scientifically, we know what works in terms of preventing exposure, reducing risk, et cetera. Practically, I think, to your point, in terms of developing these strategies, I think in addition to these strategies being actually developed, it's also one, how good they are, not only on paper, right? It's also how to effectively execute these strategies in the real world. So, for example, we can say if positivity reaches a certain number, we'll reinstate mask wearing, for example. But, if they are external factors that limit rules implementation, then these actions are unlikely to work or to be successful. In that context, I think another important consideration is sort of not only on the practitioner or the government side in terms of developing, implementing the strategies and tactical actions, but how do we increase acceptance and uptake of these measures or other public health interventions? For example, there are shorter term actions like public health messaging or effective messaging and communication during a campaign, during a vaccination campaign. But in that vein, for example, the bigger picture here may actually be health literacy in the long term for vaccine uptake, right? For example, health literacy could be a important distinguishing factor between, I think vaccine hesitancy versus vaccine resistance, where, the former may be attributed to sort of individual anxiety or unfamiliarity with scientific research as opposed to sort of vaccine hesitance, unyielding resistance that is actually due to personal beliefs or political influences, right? So, but I think taking a step back, how we navigate through this pandemic or future endemic environments, not only how government or the public health community acts or responds, but how accepting the public will be. And on the latter, I think it will be important to understand social behaviors and, when necessary, understand where changes can be facilitated, like through health education to improve health literacy in the long term, right? So, as public health practitioners, we are worried about sort of the immediate impact and immediate adverse health effects of this pandemic. But at the same time, we also want to sort of keep in mind, based on what we are learning now, how do we mitigate or minimize the disease burden sort of, in a future scenario?
Yeah, one of the things that you're talking about there, which I hadn't listed, but is real critical, is the idea of communication between our health officials and the public. And I know that's been an area that's received a lot of scrutiny during the response to the pandemic. And it's going to be just as important moving forward, right? Is what I talked about earlier, this idea that we're going to continue in this cycle where we might see increase in cases and perhaps reinstating certain restriction measures. Like what you talked about, the uptake from the public on that guidance is really going to depend on how effectively we can communicate it to them. Here's the benefit to you of masking up again for a short period of time, or here's the benefit to you of quarantining yourself because you might have had an exposure or whatever the case. But here's the benefit of receiving the vaccine or receiving another booster. We really got to pay a lot of attention. I say we, but sort of in the collective sense as public health practitioners, really have to pay a lot of attention to how we're crafting those messages and how we're delivering them and making sure that we're reaching all the populations we need to reach. As you mentioned, what can we learn from the past 2 years about groups that have been hard to reach in the pandemic? And what can we do differently to try to get to them and to try to deliver a message that they understand and accept and will act upon? So I think that you're right. That's going to be an important to kind of figure out what those lessons are and then to incorporate them as we move forward in this new period. And along the lines of things like testing and quarantine, we still have not really ever had a real coherent testing strategy. And I think we're going to need that going forward. And we're going to need availability of tests that are easy for people to access and are not cost prohibitive. And we're going to need to figure out what's the right guidance going to be, going forward. If your child has an exposure to someone at school, a high risk exposure to someone at school, what are you going to do in terms of keeping them out of school, making sure they have access to tests, monitoring for symptoms and that sort of thing. And the last thing I'll just mention is trying to figure out how we get further penetration into communities that haven't been vaccinated yet, that don't want to be vaccinated, that maybe are afraid of being vaccinated or just haven't been able to receive it because they haven't had access to it. Is how do we continue, not give up on these groups, but how do we continue to work with them to try to get these segments of society vaccinated, because that has shown to be a very, very effective way to control against severe illness. So any thoughts kind of, I guess, on that before we shift topics?
Yeah, absolutely. And communication really is the foundational tool for improving public health outcomes, right? Because if you really think about it, communication is that nexus for integrating the distinct disciplines and the specialized expertise that encompass public health and social science and policy and practice. And I think in terms of improving vaccine uptake, vaccine coverage, or saturation, and not only on that, but also other forms of medical countermeasures or pharmaceutical interventions. In that context, I think speaking through communication, I think effective communication to facilitate these things is not only about sort of the proper complexity and the thoroughness of information, which I think sometimes has been a source of frustration, as we have seen in the media, but that complexity, the thoroughness information, but at the same time, it is about the processes and the formats and the platforms of delivery, right? So with sort of the spectrum of communication outlets and stakeholders that we have these days, whether it's news media, print media, or social media, whether with or without intentions among the spectrum of communication outlets and stakeholders, there also is the potential for bias or the opportunity to sort of create misinformation or disinformation with or without intent. And I think this is an area that we as the emergency management community and also the public health community should really dedicate some efforts in looking at not only the content of these messaging, these communication, but also sort of the proper platforms and the processes for actually getting that message through to various population cohorts.
Yeah, you mentioned the disinformation. That's a huge topic. Maybe we'll tackle in another podcast, but certainly important. Let's transition to that next topic I want to talk about, which is we're sort of at this point now, this juncture, an important juncture. And I think continued research is going to be really important to help us navigate not just the next several months, but the next several years in dealing with the SARS-CoV-2 virus. So I want to talk a little bit about what you think priorities for, ongoing research should be. And I think you've hit on a couple that are kind of really important. I was thinking of it more from the standpoint of continuing to understand the evolution of the virus and our immune response, whether it's through vaccine or through natural immunity and the strength of that, and whether we need additional boosters based on the rise of new variants, et cetera. But I think you hit on a couple of other things that were really important too, which is continued research into areas like health literacy and how to improve that. And also another one that you mentioned that I was kind of intrigued about was continued research on individual health behaviors and what are the things that motivate people to behave a certain way or to act upon guidance from officials. For public health agencies as they're moving into this period, what are some of the things that you would like to see research really focus on?
We're talking about scientific research. This could be the universal vaccine that the scientific community has been trying to understand and develop for the long term. At the same time, it could also be sort of variant-specific vaccines, when these new variants emerge and pose an immediate and severe threat. And also, I think especially lately, we've been hearing about whether it's mild COVID during the Omicron surge, and also, importantly, I think long COVID. Recently, there was a study in Canada that looked at functional mobility after COVID-19 in adults aged, I think it was 50 years or older in community living settings. And they found that those with confirmed, probable, or suspected COVID-19 cases or infections had nearly twofold higher odds of worsening mobility and physical function compared to those without. And I think not necessarily a research priority, but sort of that intersection between research and practice is looking at some of these long-term impact, especially on certain population groups. So, some of the persistent health issues, right, have this disproportionately affected vulnerable population groups and in the public health community based on population vulnerabilities. Maybe, we can dedicate time, efforts in research.
Yeah, I'm glad you brought that up because we do often think of COVID in the immediate sense, but understanding the long-term implications is going to be so important. You could probably spend, the rest of the day talking about this, but I want to pause here. I want to thank you again for taking time out of the day to join us on the podcast. It's been great talking with you. So with that, we'll close the podcast today. Thanks again for your time and hope to have everybody back again at a future date.
Thanks for listening to CNA Talks. The views expressed are those of the commentators and do not necessarily reflect those of CNA or any of its sponsors. CNA Talks is produced, edited, and mixed by John Stimson. Our theme music is by Edward Grenga. If you enjoy our show, we'd love if you could give us a 5-star review on Apple Podcasts and tell your friends about us. Thanks again for listening, and we'll see you in 2 weeks.